Heart failure is not only a common medical problem but also an important public health issue. Heart failure unfortunately kills. Yes, it does. Heart failure is now recognized as the second biggest killer in the world. It kills more than some of the commonly known cancers like breast cancer, prostate cancer, skin cancer, bladder cancer, and so on. There are 38 million patients of heart failure all across the globe. Unfortunately, we do not have any figures from this part of the world, and that is primarily because of lack of awareness, not only amongst the patients, the general public, but also amongst the healthcare professionals. Now, what is heart failure? Heart failure is essentially the poor pump function of the main chamber of the heart. It is either due to weakness or stiffness of the heart muscles. The heart doesn't pump enough blood forward, and therefore there's a backflow of the blood that goes into the lungs and the rest part of the body. Some of the common symptoms of heart failure are shortness of breath, particularly on exertion and while the patient is lying flat, dry cough which occurs particularly at night, a weight gain which is not very well explained, palpitation, dizziness, fatigue, and generalized weakness. Now, there are some common investigations that are done for heart failure, and they include a lab test or a blood test, which is very sensitive in picking up early heart failure. Others are an EKG or electrocardiogram, a chest X-ray, and a scan of the heart, which we call echocardiogram. There are a number of medications and treatments available for heart failure. Unfortunately, there isn't a cure for heart failure, but the good news is that heart failure is preventable, and it is achievable only if we increase the awareness of heart failure amongst the general public. Some of the common causes of heart failure are heart attacks, which have either already occurred or impending heart attacks, high blood pressure, poor heart muscle function, and valvular heart disease or disease of the valves. Therefore, it is important that the heart failure symptoms are recognized early and they are diagnosed early. This would not only save hospitalization but a lot of resources that are spent on heart failure. So if you do develop any symptoms of heart failure, namely shortness of breath, a rapid weight gain, or a dry cough, do seek help from your doctor or a healthcare professional or a nurse. Thank you very much.